attached to the body of the uterus are the broad ligament, the round ligament, and the ovarian ligament. This is the ovarian ligament. It extends to the ovary and has been demonstrated earlier. This is the broad ligament. It is formed of two layers of peritoneum, an upper layer and a lower layer. The dense connective tissue present between the two layers is called parametrium. The ligament has a free anterior border which encloses the uterine tube, and a posterior border which is attached to the floor of the pelvis and is called the root of the ligament. It has also a medial border attached to the side of the uterus and a lateral border attached to the side wall of the pelvis, where it crosses the external iliac vessels, umbilical artery, and obturator nerve and vessels. The ligament has an upper surface which is related to coils of intestine and a lower surface related to the urinary bladder, especially when it is distended. Note the uterus and its two broad ligaments form a transverse partition in the cavity of the pelvis between the bladder anteriorly and the rectum posteriorly. The broad ligament is subdivided into four parts called mesovarium, mesosapiens, mesometrium, and suspensory ligament of the ovary. This is the mesovarium, which is a prolongation of the upper layer of the broad ligament to which the ovary is attached. This is the mesosapiens, which is the part attached to the whole length of the uterine tube. It is the anterior part of the ligament. This is the mesometrium, which is the part attached to the side of the uterus. That's to say, the medial part of the broad ligament. This is the suspensory ligament of the ovary, which is the most lateral part of the broad ligament, extending from the infundibulum of the uterine tube to the side wall of the pelvis. It is also called the infundibulopelvic ligament. The contents of the broad ligament are mainly two tubes, two ligaments, and two arteries. The tubes are the uterine tube, which passes in its free anterior border, and the ureter, which passes in its attached posterior border. In the root of the ligament, the urethra passes from behind forwards, only 1 inch lateral to the cervix, and is crossed by the uterine artery from lateral to medial. The two arteries are the uterine artery and the ovarian artery. This is the uterine artery. Which arises from the internal iliac artery and runs medially in the root of the broad ligament, crosses the ureter, and then ascends on the side of the uterus where it has a tortuous course. As it reaches the uterine tube, it turns laterally below it and runs parallel to it to anastomose with the ovarian artery. This is the right uterine artery running upwards along the side of the uterus with a tortuous course till it reaches the medial end of the uterine tube, where it turns laterally below and parallel to it. On the side of the cervix, it gives a descending branch which supplies the cervix and the vagina. These are the ovarian vessels, passing through the suspensory ligament of the ovary to enter the mesovarium. The artery passes medially to anastomose with the termination of the uterine artery. The two ligaments, which are part of the contents of the broad ligament, are the ovarian ligament in contact with its upper layer, and the round ligament of the uterus in contact with its lower layer. To sum up, the two tubes within the broad ligament are the uterine tube and the ureter. The two arteries are the uterine artery and the ovarian artery. And the two ligaments are the ovarian ligament and the round ligament of the uterus. This is the round ligament. It passes through the broad ligament to reach the deep inguinal vein, where it hooks around the lateral aspect of the inferior epigastric artery, as the case of the vas deferens in the male. The round ligament then runs in the inguinal canal and comes out through the superficial inguinal ring to get attached to the subcutaneous tissue of the labium majus. This is the inguinal canal open and this fibrous cord is the round ligament of the uterus, going to the labium majus. This is the ilioinguinal nerve passing along its side. The cervix of the uterus is the most fixed part of the uterus. The strongest ligament attached to the cervix is the McInroth's ligament, which is a transverse ligament consisting of dense fibrous tissue surrounding the pelvic vessels, which extend from the side wall of the pelvis laterally to the bladder, the vagina, the uterus, and the rectum medially. This is the McInroth's ligament or transverse ligament of the uterus.